we start off, well, right now, a brand new list of tests that doctors say you simply do not need. 135 tests, in fact, according to the latest research for more than a dozen medical societies. So which tests should you get? Which ones should you skip? Some important information today from Dr. Ernest Patti. He's a senior attending physician of emergency medicine at St. Barnabas Hospital. Certainly you order a lot of tests, Dr. Patti.
We do.
But which are the top ones that maybe red flags we should avoid?
Well, we can't just make a list right now and say you don't need these ever. Obviously, every patient interaction is key. There are some, though, that we definitely overutilize, and old habits are hard to break sometimes. You know, overutilizing x-rays, CAT scans, total body scans, tests of this nature, as I mentioned, and overprescribing antibiotics.
Let me ask you about those total body scans, because I hear those commercials on the radio now and then. You know, go in for this total body scan, and you're going to figure out, you know, if you have cancer or there's some unknown illness that you need to check out. Why is that not a good idea? Why isn't more information better?
Many times they use a high intensity CAT scan, and you're getting a whopping dose of radiation, which, you know, over time, the radiation dosage that your body receives adds up and could contribute to you developing a future cancer down the road. So if you don't need this type of test, if you're asymptomatic and you don't have any illness or issues, why go and get it? And occasionally they find things in areas that are inaccessible that may be benign but may cause concern for you.
There's that fear of missing something that's just out there for all of us. And I wonder for you as a doctor too, a patient comes in, they have certain symptoms. Let's say there's 5 different tests you could give, but you decide to give 2. Are you worried about not giving those other 3 because of litigation, because of a patient coming back and saying, hey, doc, we missed these other 3 tests, and now I'm suing you?
That's a big problem that many physicians and myself grapple with on a daily basis, definitely. You know, medicine is a science, a constantly changing science, but also involves sort of an art to it, and that art is being able to evaluate a patient, making them feel comfortable, and getting information from them both verbally and from your physical exam to help you go down the right path.
So how can we empower patients and our viewers out there so that we know what questions to ask our doctor before blindly taking a blood test or an x-ray? Are there certain things that we should just inquire about? Because for the most part, when we go to the doctors, we trust what you're telling us.
Oh, most definitely. But patients should ask, you know, do I really need this blood test? Do I really need this radiological study? You know, is it necessary for me to get this kind of CAT scan? They really should ask, and especially parents when they're taking their children to the doctor as well. If the doctor doesn't give you the satisfactory answer by speaking with you, then maybe you should look for another doctor, because doctors need to explain why and when we want to do things.
How is this affecting costs, healthcare costs in general, the abundance of tests that we can do now versus what we could do 50 years ago?
Well, it's definitely pushing costs up, especially the specter of malpractice. You know, physicians are worried that, you know, you're going to get sued for making that or missing that one diagnosis that maybe is very rare, and it definitely causes some physicians to overutilize tests.
And so do you think the problem is more on the side of the patients or more on the side of the medical profession? And not to place blame, because there's obviously the environment that's out there just because of the amount of tests, the amount of litigation, the amount of information we can do as far as research on the internet as well.
Exactly.
So those are all components. But where do you think the overdoing it comes from? Is it from the patients or is it from the doctors, you think?
Well, I think it's from the doctors trying to protect themselves and their patients, both from the patients getting disease and from the doctors themselves being sued. I think the blame has to lie in actually both areas.
Is there,
it really does.
Just to take
it's hard to put it on one spot.
You're right, it is. That's a difficult question. On the other side of the coin, I'm curious if there's a test that patients often don't ask for and doctors often don't give that might be something that we should know about.
Sometimes the test of time, and many times that's what we use as physicians. We want to see you again in a couple of days, in 48 hours, re-examine you, maybe have a contact after the first encounter to see if you're progressing towards improvement or if you're worsening.
The test of time.
The test of time.
Very clever, Dr. Patti. It's good though. It's something.
Much.
It's hard to have patience in this world that we live in, but maybe it's beneficial for both doctors and patients.
It really is, but the key is communication between the doctor and the patient, both ways.
Good point. Dr. Patti, great to have you on set as always.
Thanks so much for having me.
Pleasure to have you. John?